Good afternoon. My name is Jesus Martell. I am here today to talk about a very serious disease that is affecting a lot of people in our society. I'm here to talk about strokes. A stroke is a disease in which part of the brain is damaged because of lack of blood flow, either because of a ruptured aneurysm in your brain or because of a blood clot that has stopped blood flow to a certain area in your brain. Annually, about 800,000 people are affected by a stroke. 20% of those 800,000 end up in a loss of life. I personally have had my mother and an uncle suffer strokes in the past. There are signs and symptoms that people need to be aware of that are telling people that they are having a stroke or leading up to a stroke. Numb face, limbs, or one-sided weakness are some of the symptoms that are exhibited in patients having a stroke. There are many reasons people have a stroke. Some of the reasons are that people do not adhere to drug regimens when they have been diagnosed with such diseases as high blood pressure or high cholesterol levels. People that have high blood pressure are at most risk because of the blood pressure in their system can cause an aneurysm, and that aneurysm can burst. People that have been diagnosed with high blood pressure and fail to take their medications always have a reason. One of the reasons is they can't afford their medication, or they forgot to take it, or they don't have insurance and they're not covered. The same goes for people with high cholesterol levels. High cholesterol levels can also lead to people having strokes. And the same goes for them. They say their excuse for not taking their medications is they can't afford them or they forgot. Another thing that people can do to help themselves when they have high cholesterol levels is change their eating habits, and people fail to do that as well. Strokes leave lingering effects on the patients that suffer a stroke. They suffer from loss of vision, or they suffer from paralysis or hemiparalysis, which is one-sided weakness, whether it be your right side or left side. Something else that is suffered that leaves a lingering effect from the stroke is aphasia, which is impaired speech. People speak with a slur and it's very difficult to understand them. Something else is dysphagia, which is trouble swallowing, which in turn leads to people having trouble taking their medications or eating and swallowing, so they become malnourished or are not able to take their medication, and they suffer greater effects from not taking their meds. In the healthcare field, there's an acronym that is used to help people identify a stroke. The acronym is FAST, F-A-S-T. The F stands for face. Like I said, you will see an uneven smile or a droopy face or a droopy eyelid. The A stands for arm. You will have a patient that has almost no strength in one side or the other in their upper body, in their upper limbs, as well as their lower limbs. The S stands for speech, which once again is for people having slurred speech and is very difficult to understand. The T in FAST stands for time. The time that it takes for someone to identify a stroke victim and call 911 is very crucial. The sooner somebody recognizes it, the sooner they can get them in an ambulance, take them to the emergency room, and start a stroke protocol, which is medications and giving CT scans and other things that will help reduce the effects of a stroke. They get caught soon enough, they can minimize the effects, and the people will thank you greatly later when they don't have these lingering effects for the rest of their life. Ultimately, there are two types of strokes. The first one is a hemorrhagic stroke, which, like I said, is caused by an aneurysm that bursts or leaks in your brain, and then it impedes the blood flow to the rest of that area of the brain. Second one is an ischemic is an ischemic stroke, which is when a blood clot stops blood flow to a certain area and prevents that part of the brain from being fed by blood that is oxygen rich. In talking about these strokes, we need to become very familiar with them and the effects of them, so we can go ahead and help people that are showing symptoms or signs of them, and they will thank us later, not only helping other people, but very possibly knowing the effects and knowing the symptoms, so we can help ourselves as well as anybody else. Thank you very much. I appreciate your time.